We're going to talk about 5 billing mistakes that are likely draining your profits today. Before we get into the content, I just want to ask, is dental billing making you feel like this? So many of us want to pull our hair out. We're trying to get through everything every day. Overwhelmed, understaffed, just pure chaos at the front desk. We've all been there, and wisdom can help you change that. In addition to providing resources like this webinar and valuable content, Wisdom supports dental teams nationwide with dental billing services. We remove your administrative stress so you can leave the chaos behind and feel more like these people. Not that we all dance behind the front desk when we feel this way, but if this is how you feel in your mind at work, that's all that matters, right? Just a quick rundown of our services. We provide insurance billing and verification, patient billing, e-schedule updates and ledger audits, and pre submissions, amongst many other things. We're always here to help. You can email us just for advice or to figure out where to go. If we can't help you, we'll find out who can. Get in touch with us by emailing info@withwisdom.com. All right, now let's identify and alleviate those hidden revenue leaks. What we're going to cover the 5 most common but also overlooked mistakes or oversights that cause you to lose revenue, as observed and experienced by our team who've had the opportunity to support collectively thousands of offices in their careers. And for each mistake or oversight, we're going to give you some solutions or prevention measures to stop the stress. Additional resources at the end of the webinar via links and a poll for a follow-up will follow all of the content. So we just want to make sure if there's something we talk about during the webinar, you can get it. So we'll ask you about that. Last but not least, we'll have a QA session. There is a QA button at the bottom of your screen. If you have a question while the presentation is running, the live presentation, then just type your question in there. And when we get to the end of the presentation, we'll circle back and we'll get answers and share them with the whole attendee group. Once again, if you think of something after the webinar, just email us at info@withwisdom.com and we will get you what you need. Did you know, this is a staggering number, that over $16 billion is lost annually in dentistry in collections in the United States? That's crazy. For the most part, on average, offices are collecting 90% of what they're producing rather than 100%, which you can be there. Some are even lower than that, and they think it's just hopeless and they can't overcome that, but you really can. Where's the 10% going and why? Well, in a previous webinar, you produced it, why aren't you collecting it? We talked about the chunk of it that's going to claim rejections, denials, write-offs, and unpaid balances. And I'm going to give you a link to that recording at the end of this if you really need some in-depth insurance revenue strategy. But today, we're going to talk more about why all of those things happen, the rejections, denials, write-offs. We're going to talk about what causes the errors, what's lacking in the processes or training or staffing, because it isn't all just about insurance billing. So we'll get right into it with mistake number 1, verifying insurance at the last minute or not at all. And I know we've probably got some staunch, we don't need to verify people in our audience. That's okay. I've been there too. But not doing that, why it costs you a plethora of things: denied claims, lost revenue, frustrated patients, incorrect or missing details in your claims cause delays and extra work for you in the follow-up. It strains your relationships with your patients and your cash flow. We'll see a few of these light bulb moments throughout the webinar, so hopefully if you don't look at anything else on the screen, look inside the light bulb. Follow the light. Insurance verification is the foundation of successful insurance billing. If it fails, your entire revenue cycle will fail. And for the naysayers, it's okay, we got you. We send pre-Ds, or we don't have time to verify insurance. Or if you're out of network and you just filed a claim as a courtesy, you collect everything up front. Filing insurance as a courtesy, I don't need to worry about verifying. Well, the thing is, predeterminations, and we're talking pre-D, not pre-auth, which a pre-auth is required for coverage, right, with your state-funded plans and things like that. Pre-Ds sent voluntarily to try to authorize guarantee of payment actually aren't that at all. We see it all the time. Claims are denied even if a pre-D was approved. So it does not replace insurance verification. Not to mention maybe the policy terms after you send it and you don't catch it. It can happen in a day. A lot more time spent reactively versus proactively, and you're going to hear me say that a lot, and it frustrates your team and your staff. And back to out of network. So you're out of network, but you still file insurance for patients. You collect their balance up front. They're waiting for their check in the mail. Guess who they're going to call when they don't get that check from the insurance company? They're not going to call the insurance company. They're going to call you. And then you won't know what's going on. And come to find out, they didn't even give you the right insurance in the first place. Here's what you can do instead. You can develop a process. You can, I promise, for verifying insurance at least 48 hours before every non-emergent patient visit. If at a minimum, full breakdowns are ideal, but at a minimum, you should get these bullet points. Verifying the subscriber and member ID, not always the same. The eligibility date, how much they're allowed to use in the year and how much of that they've used. Verifying the group number, the mailing address. Even if you're not going to mail the claim, it's got to be correct on the claim to get it paid, and the payer ID. Even further than that, for the we don't have time people out there, which is very, very common, it's such a strain, delegate it to a specific team member and allow them blocked out time when this is their primary focus. I know some offices are running with only one person at the front desk, and that would be really hard to overcome. And we'll talk about understaffing and lack of training later. But at any point, even if you have an assistant or a hygienist with downtime who can just answer the phone and schedule appointments, you can get a lot more done in quiet time verifying insurance than when you're multitasking, which so many of us, if you're working in office, have to do. Utilize portals and technology over phone calls. Being on the phone with reps takes a lot more time than digital verifications. And, back to if you only have one person at the front desk, insurance verification is super easy to outsource to a trusted company and just stop worrying about it. Whichever route you go, having a digital copy of the patient's insurance card is essential. You want that stored. And if they don't have one and you find their plan online, take a screenshot or download a PDF and put it in their chart. That way, if you have an error later, you can look back at that and the dates. You never know, you may need it to fight a claim and have all the info that you took so much time to get right there. Don't just enter it in the software and move on. Now, getting into mistake number 2 is about not wasting all of that hard insurance verification work. Failure to set up insurance plans properly in your practice management software and keep them updated is mistake number 2. Look at it like this. You verified the insurance, you got a full breakdown, it takes a lot of time. So follow through in your software. Do you have a standard operating procedure for updating insurance plans? If more than one person is doing it, is everybody doing it the same way? Is every field being filled out the same way? Have you and your team been trained in your practice management software as far as what the right fields are? And I mean more than just entering new plans, and we'll get into that too. Do you save the breakdown form or the PDF? Where does it go? Where can it be referenced later? Is everybody putting it in the same place in a digital file or in the patient's chart? These are all simple yet essential and also overlooked. It costs you because the number one reason, light bulb moment, for denied and rejected claims is incorrect patient and insurance information. That often stems from typos and lack of practice management software knowledge, which loops us back to that standard operating procedure and the training piece of it too. Not having these entered properly, having typos, not having the right documents to refer back to creates more than just denied claims. It creates incorrect ledger balances and treatment plans, disputes, delayed coordination of benefit processing. So when a patient has more than one plan, and then you've got a team that's probably already stressed out, wasting time on follow-ups instead of just getting your claims paid the first time around and or having that breakdown information in a place that's easily accessible where everybody knows where it is. What you can do instead. The answer may seem simple, but we'll unpack that a little bit here. Ensure the plans in your system are set up and maintained through a defined process and dedicated team member. This applies to more than entering new plans and updating existing ones. So, part of that defined process is what I already talked about with storing the info, entering it in the correct fields in the right manner, but also your payment poster. So, you're moving beyond the insurance verification and into payment posting or even working the aging report and denied claims. When you're posting, are you updating the deductibles? Are you making notes? Is everybody doing it the same way? Are you updating the payment tables? I'll reference Dentrix. It asks you, do you want to update the payment table? Most of the time you want to say yes. Sometimes you don't because maybe it was a partial payment. Does everybody understand that and apply it the right way? Does everybody understand the birthday rule and know how to set up primary, secondary, and maybe even tertiary insurance in your system? The birthday rule: the parent with the earlier birth month in the year has the primary insurance regardless of the birth year. So if a parent was born in April of 1990 and has insurance for a child, and the other parent was born in February of 1991, who has the primary and secondary insurance? It's going to be the February parent. It's the month, not the year. Monitoring group numbers. Maybe you're one of those offices that has a company nearby and all of their employees have the same plan, right? There may be some variances with maximums or whatever, but are the group numbers all the same or are they different? Do you need to re-enter the same group number every single time you get a new patient? No. You just assign the plan. That can speed up your IV. Not knowing how to do it properly, though, could potentially make you update a plan the wrong way. So that takes us back to, do you and your team know how to execute all of these things in your practice management software? All right, now let's say your insurance verification's solid, plans are updated, but you still have some issues with your patient balances. That's mistake number 3. Allowing patients to leave or be seated without paying their balances. I'm sure we're causing some alarm bells to go off again here, and that's okay. Let's talk about why it costs you before we talk about maybe any pushback. When patients leave without paying their balance, like with anything else, the longer the payment is deferred, the harder it becomes to collect. It gets farther and farther away. You have to make a phone call. You have to send a statement. You have to do all these things instead of just collecting it when they're right there. And I really want you to think about this. Asking them, would you like to pay your balance? We'll get into the how later. Would you like to pay your balance is the least effective way to collect patient balances. If you go to the grocery store and they don't ask, would you like to pay for your groceries, right? It's just expected. You pay for them. So, back to some of the pushback. And I used to have this in my mind too. Totally get it. Patients want to be billed after insurance. It's awkward to ask for payment in advance. But thinking through that mindset, when you go to the doctor, you pay your copay or you pay if you're having a major procedure, they expect you to pay it before anything's done. So anything's possible with the right communication style, tone, and expectation. And in the long run, a lot of patients may find they prefer this rather than receiving text, email, statements, and phone calls or giving the card information that they have virtually or by phone. So what you want to do instead is establish a process. So process for collecting payments at the time of service and stick to it. Get aligned with what your system is for this and how you communicate it to your patients so everybody sets the right tone and expectation. You can use route slips. Yep, it's still okay to print paper sometimes, and treatment plans to ensure balances are caught and collected before the patient leaves. You can address the balances up front with elevated language. And what do I mean by that? Here are some examples. Using positive affirming language, like these examples, when patients ask, well, why can't you just bill me after my insurance or can I pay it later? When you say this out loud, it's so much better. So you can see here, it's like, hey, you have a balance. Let's get it taken care of and make it convenient for you. To keep your account current, we'll collect your portion of the balance today. Would you like to use a card or another payment method? Likewise, if somebody's checking in and they have a balance from last time and you know they're going to have a balance for that day, you can just go ahead and say, I see you have a balance from your last visit. Let's go ahead and process that with today's estimate for you. That way, you can just leave when you're done. It's really all about how you frame it. Okay, now we're going to move into the next mistake. Your patient paid their balance, but they're frustrated that an old claim hasn't paid. They're asking, did my crown get paid? Why do I owe this? And you're kind of scrambling. Like, I don't know. Let me just go ahead and resubmit that claim. Stop! Rushing claim submission without thorough review is mistake number 4. If you submit claims without attachments, documentation, everything that you see on the screen, they're probably just going to get denied or delayed, and then you have to appeal it or submit more info, which takes a lot longer than just getting it out clean the first time. Likewise, blindly resubmitting claims that aren't paid does not get them paid or get you answer. This is when faster is definitely not better. And by blind resubmit, I mean that scenario we were just talking about where a patient's just kind of right there in your face and your claim's not paid and you're sitting there and you're like, I don't know, let me just resubmit it. That can actually harm you. Clinical teams should support administrative teams by ensuring they properly document diagnosis and treatment for all procedures prior to claim submission. And I can guess some of the things your clinical team probably says about that. I don't have time for clinical notes. I didn't know we needed a new x-ray. No one documented the diagnosis. So, has your administrative team set your clinical team up for success to make sure they have what they need to give you what you need to get these claims paid? What to do instead? Ensure your clinical team knows what's needed to include for every procedure. I'm not asking you to make them remember everything that you remember, right? There are a few tricks. First and foremost, with their clinical notes, they can use the SOAP method. If you haven't heard of that, I'll reference our webinar, You Produced It, Why Aren't You Collecting It? We do a little bit of a deeper dive there, but just a quick review of that here. Every time a patient is seen, even if they've got something stuck between 2 teeth and you've lost it, it may seem silly, but all of this should be covered. You want the subjective part of the visit, the objective, the assessment, and the plan, and that's where the SOP comes from. This is a part of an ebook that we have as well, our dental billing cheat sheets, which also includes an attachment cheat sheet. So you're thinking, I don't have time to tell these people everything that they need. Well, guess what? You can print this and keep it at a station where everybody needs to see it, whether you print it and put it on the wall or it's just on the desktop, use it. We'll have a QR code at the end of the webinar for you to download this in order to help your clinical team know what they need for every single procedure that requires attachments. Maybe you've got those taped everywhere, but you still hear, nobody told me that. Nobody told me to look at the thing taped to the wall, or nobody told me that was on the desktop in my operatory. That's mistake number 5. Neglecting training and ongoing continuing education for your team. So many things can fall through the cracks. It costs you because, circling back to the practice management software again, you probably have at least 1 or 2 people in your office that know the software like the back of your hand, but there's so many softwares out there now that it's not common for everybody in the office to know it. So it should be in a manual somewhere. Otherwise, you're just always reteaching people or fixing mistakes. All of your office-specific standard operating procedures are going to be what set your practice up for accuracy. What contributes to this the most, as far as it not being done or done well, are staffing shortages. Staffing shortages are the greatest obstacle to consistent training and dental practice growth. Overwhelmed and or undertrained staff are far more likely to make common mistakes. I mean, we've all been there. Again, multitasking, or you're just doing too much at once or thinking about too much at once. It causes all these mistakes. That's a lot, right? If you're reading through those bullet points, that takes us back through the previous 4 mistakes. It comes down to this. And unfortunately, and this is a real statistic, 70% of offices experience staffing issues. So if the people who are doing the work can barely get the work done, how can they teach other people to do the work? And it's just this vicious cycle of, nobody told me that, or I didn't know how to do that, or I don't know how to do this. And that can even lead to the last bullet point, which is neglecting the schedule or mishandling phone calls, even with the best of intentions. I just want to pause for a little story time here. A social media story in a Facebook group. Saw a person ask or tell a story about how they had a service that documented their call log, and the doctor found out that their person at the front desk had been telling patients that they didn't have any appointments available for weeks or months and were referring them to the office down the road. Now, they did have room in their schedule. They did. So in this comment thread, in this Facebook group, everybody's talking about firing the person, or the repercussions of their action are just mean, or are they unsatisfied? But the thing in the back of my mind was, are they overwhelmed? Because that's the most glaring answer to me. They don't feel like they have time to do a new patient intake call and take down the information because they're doing so many things at one time, and it's easier just to say, go to doctor such and such. It makes sense, right? What you can do instead: invest in thorough training for your staff and use standard SOPs. So, making sure your team understands how to verify insurance, collect payments, document treatments. You can use role playing, have an assistant sit behind the desk while your administrative person brings a pretend patient up, another staff member, and have them act like each other to give them some perspective, or vice versa. Walk through these things. Document how everything needs to be handled. That way, if somebody is sick or takes a vacation or something happens, you can have somebody float and cover somebody else's job. It may not be fantastic, but you can have an assistant sit down and verify insurance if you have it documented. There are a lot of CE and staffing options out there. We have webinars, just like this webinar today. There are in-person training sessions, like I'll reference Dentrix again. There are consultants who specialize in Dentrix. You can get a hold of a vendor, like if maybe you have Open Dental, get a hold of your rep and say, hey, we need help. We need somebody to come in and train us. Record it, record everything so that you have it, especially if it's virtual. You can go to conferences. Conferences will teach you so much. Even if you just go to your local conference, you don't have to spend a lot of money on plane tickets and travel all over the place. Just go to your local state association conference and talk to people, attend the classes that are offered. You can also consider the many outsourcing options that are available to you, whether it's Wisdom or somebody else, whether it's just insurance verification or just patient billing or just the whole insurance billing cycle. You can pick and choose what you outsource and what you keep in-house. You can do a little bit at a time just to test it out. You can do it all at once and stop worrying about it. In the meantime, as mentioned, I have a couple of QR codes for you here. Code on the top right there, that's for those dental billing cheat sheets. So your oral cavity codes, attachments, the soap guide. There's even a perio notes guide in there with staging and grading, and insurance company fax numbers if you need those for breakdowns or whatever the case may be. If you can't find things on portals, down below, that webinar that I mentioned, you produced it, why aren't you collecting it? Taking a really deep dive into insurance billing fundamentals and some patient collections. Scan that, download that. You, again, can also email us at info@withwisdom.com if neither of these fit the bill. If you're just kind of wondering, how could we help you specifically? Or you feel like you're just not sure how this works, or maybe you think your office is nuanced. There's a lot that we've seen. We're always willing to help, and we hope to hear from you. And thanks for watching our presentation.